Dry eye really has clinical signs that are general, non-specific signs of keratoconjunctivitis, inflammation of the cornea and conjunctiva. So you'd get secretion, you'd get conjunctival congestion, you would get corneal pigmentation, vascularization. All of these are really non-specific signs of inflammation. I'd say there is one specific sign of keratoconjunctivitis due to dry eye, and that is that the cornea is dull looking. You can really see that it's not as reflective as always. The disease also has very typical history, and that should give you a hint that you are dealing with dry eye. The history the owner would give is that the dog had an inflammation. They went to a vet who prescribed some kind of drops. The drops worked wonderfully. While the dog was on these drops, the inflammation went away. As soon as treatment ended, the inflammation came back. So they went to a second vet. He prescribed a different set of drops. It worked wonderfully for 2 weeks. When treatment ended, the inflammation came back. They went to a third and a fourth vet, etc. I would say that diagnosing dry eye is a no-brainer because it's done with a Schirmer tear test that takes all of 120 seconds, 60 seconds in each eye. So every dog that presents to you with a red eye, every dog that presents with signs of discomfort or discharge, there is just no justification whatsoever for not doing the Schirmer tear test. You'll have your diagnosis, and it's also a very visual diagnosis. You can take the strip of paper, show the owners, and tell them, you see, tear production normal dog is down here, your dog is up here, and we need to prescribe accordingly.